Hello everyone. Welcome to today's live presentation. I am Dr. Mohan Raut. I am a practicing gynecologist and clinical reproductive immunologist. We have our centers, Dr. Raut Centers for Reproductive Immunology in Mumbai and in many other parts of India. And at these centers, we treat couples who have unexplained repeated miscarriages or recurrent IVF failures or unexplained infertility using our patented and branded process of lymphocyte immunization therapy, also called as Imulate, along with other immunomodulatory treatments. But in today's live presentation, I am talking on something else, and that is about a very important topic, and that is age and fertility. How are they related? Is it too late to conceive? Know the truth about age and fertility. So, when it comes to having children, age is an important factor to consider. As we get older, our fertility naturally declines and the chances of getting pregnant also decrease. But what exactly is the relationship between age and fertility, and how does it affect our reproductive options, we will see today. First thing is, why should we discuss about fertility and age? Now, you will agree with me that fertility is an important part of a couple's life. It is important not only for personal satisfaction and fulfillment, but it also has tremendous impact on the social life of the couple. Almost 15 to 17% of couples face the problem of infertility. There are many causes of infertility, but we are not going into those details. We are not going to discuss them today. What we are going to do is we are going to look at one important factor that has tremendous impact on fertility of the couple, and that is the age. Yes, age of wife and husband, and how does it affect the fertility potential of the couple. Firstly, let us see the physiology related to age and fertility. Because to understand the effect of age on fertility, we must know a little bit about the physiology of ovary and testes. Firstly, let us look at some basic facts. Women are born with a finite number of eggs, and as they age, their egg reserve goes on decreasing. For example, at birth, there are approximately 1 million eggs which are there. By the time she reaches puberty, there are only 300,000 eggs that remain. The number of eggs that they continue to decline as the woman ages and the menstrual cycle occurs every month. By the time she reaches her 30s, her fertility begins to decline. And by mid 40s, her chances of getting pregnant naturally are very low. Men, on the other hand, continue to produce sperms throughout their life. But with advancing age, especially after 40 years, the quality and quantity of sperms can decline, though the impact is not as severe as seen in women. So, what does this mean for individuals and couples who want to have children? So, let's see the impact of age on women's fertility first. As women age, their fertility declines due to a reduction in the number of eggs and the quality of eggs that they have, as I mentioned just now. The chances of getting pregnant also naturally decrease significantly from the age of 35, and by the time a woman reaches her mid 40s, her chances of getting pregnant naturally are very low. In addition, there is a higher risk of miscarriages, genetic abnormalities in the baby, and pregnancy complications like preeclampsia or high blood pressure in pregnancy and gestational diabetes. For example, a woman who delays having children until, say, her late 30s or 40s may face difficulty getting pregnant and may require assisted reproductive technologies like IVF or test tube baby. So it means that if they want to maximize their chances of getting pregnant, they should try to conceive before their mid 30s. Very important to remember. The impact of age on man's fertility, let's see what it does. So men too may face challenges with fertility as they age, but they typically have a longer window of opportunity compared to women. While men can have children throughout their lives, but their sperm quality and quantity tend to decrease as they age. So the risk of genetic abnormalities and birth defects also increase with the increasing age of the man. Based on the results of a recent meta-analysis, old fathers, that is more than 40 years, could increase the risk of cardiovascular abnormalities, facial deformities, and urogenital abnormalities, and even chromosomal disorders in the children because of their advanced age. Also, a population based cohort study drawing from almost 2.6 million records from Sweden has also found that the risk of attention deficit hyperactivity syndrome, the ADHD, was only positively associated with paternal age compared to their siblings. For example, a man in his say 50s may have lower sperm count and motility, and which can make it more difficult for him to have a child. Now, of course, whatever I have told you, all these are generalizations, and there are many factors that can affect an individual's fertility. You know that lifestyle choices, health conditions, and genetics can all play an important role. But as a rule of thumb, age is an important factor to keep in mind. So, what can we do to preserve our fertility as we age? So, here are some tips from me. First, consider early pregnancy. If you are considering having children, talk to your doctor about your reproductive options and any potential risks or complications. Second, fertility preservation, very important. If you are not ready to have children yet, consider freezing your eggs or sperms to preserve your fertility. Egg freezing, sperm freezing, and even embryo freezing can help individuals and couples preserve their fertility for future use. However, these technologies also have limitations and risks and may not guarantee successful pregnancy always. For example, a woman who wants to delay having children, say due to career or for say personal reasons, may consider freezing her eggs in her say 20s or even 30s to increase her chances of having baby when she is ready. The third tip is use of assisted reproductive technology or ARTs. ARTs such as IVF or test tube baby, intrauterine insemination or IUI, and donor insemination can help couples overcome the infertility due to age related factors or other causes. However, the success rates of these technologies also decline with age, and the risks of complications such as multiple pregnancies, premature births also increase with these advanced techniques. So, for example, a couple in their late 30s who have been trying to conceive for over a year without success may consider IVF as an option to increase their chances of having the baby. So, this is the third. The fourth is lifestyle modifications, very important. Practice healthy habits such as exercise, balanced diet, stress management to optimize your reproductive health. These lifestyle choices, very important to remember that these lifetime choices as smoking, alcohol consumption, obesity, and stress can affect fertility in both men and women. Maintaining a healthy weight, avoiding smoking and excessive alcohol consumption, and also practicing stress management techniques will definitely improve the reproductive health and overcoming fertility. So, a man who smokes heavily and has poor dietary habits may have lower sperm count and quantity, as I already mentioned, which can reduce his chances of having a child. Finally, the fifth one very important one, something about the role of immune system in fertility preservation with respect to the advancing age. There are four important things related to immune system and fertility which I want to tell you. Number one, fertility declines with age, but immunological incompatibility and alloimmune problems can also lead to decline in fertility. Number two, immunological treatments like what we do Immulate help in fertility preservation by preventing the immunological damage to the gametes and the fertility is improved. Number three, immunological treatments improve the quality of embryo. They increase the chances of implantation and prevent miscarriages, thus, in a way, help in fertility preservation. And number four, increase success of IVF. What does it mean? It means there are lesser number of ovum pickup procedures and this prevents formation of ovarian antibodies leading to preservation of pregnancy. So friends, in conclusion, age and fertility are very closely related and are important to it is important to understand the factors that can affect our reproductive options. You must be aware that fertility declines with age, but that doesn't mean it is impossible to have children later in life. Assisted reproductive technology such as IVF and surrogacy can offer options for individuals and couples who are struggling with fertility. Also, considering immunological treatments will help to reduce the adverse impact of age on fertility. So, by taking steps to preserve our fertility and making informed decisions about family planning, we can help ensure that we have the best chance of building the families that we desire. So, if you want to know more about this subject, then you can always contact us on our helpline number 9833201522. You can visit our website www.icprm.in. You can visit us also on our Instagram and Facebook page. And I will urge you to share this video to at least one couple. If you share to more, that is welcome. Those, especially those who are in need of this information or who want to know more about this, and I am sure you will change their life forever. So, thank you very much for attending this live session. If you have any queries, please put in the question box. We will answer your queries. Definitely, we will also arrange to have a call also so that we can have a one-on-one discussion about any specific query that you have and also give your suggestions about more topics about which you would like to know, and we will definitely include in our live sessions in future. So thanking you again and have a good night.